So I'm just going to go in talking about what childbirth education is and kind of this new offering we're bringing into this clinic and how we can have a more holistic approach to pregnancy and postpartum care. So let's get into it. All right. So what is childbirth education? So the ultimate purpose is to equip you, your partner, partners, your village, anyone that's involved in this preparation of bringing a new person into the world with the information, knowledge, and most importantly, autonomy needed so you can navigate pregnancy and the postpartum phase. Specific things that I touch on in childbirth education include guidance on how to make decisions to determine your preferences throughout the experience, which a lot of people maybe have never thought about before or have known that there are so many different options out there for you. So, this is a very important step of the entire process. I'm going to provide education on what changes your body will go through during pregnancy and how to know what's normal and what isn't, which can really help ease a lot of anxiety that can be associated with pregnancy, whether it's your first birth or your fifth birth. Things can change all the time and things can be different. Changes can include the hormone fluctuations, oral health, nutrition expectations, warning signs, etc. So, kind of all the questions you would want answered um, about what to expect during this process. Um, and then speaking of what to expect, I go into that specifically with labor, delivery, and even into the early postpartum period. We identify important questions to ask your healthcare team, which is also an integral component of childbirth education. A lot of times we just don't know what to ask to get the information that we need. So I've gotten a lot of education and talked to a lot of people and done a lot of research on different places where people have children in order to know what some of those questions are. And then ultimately providing resources within the community. This is really important as well, because as we know and as we've heard, not only does it take a village to raise a child, it is my opinion that it takes a village to have a baby as well. So if you can surround yourself with as many of those players that can be helpful with you throughout this process, that would be one of the most ideal things you could do for yourself. So resources include lactation consultants and where to find them, how to get in contact with them, massage therapists, chiropractors, other important members of your birth team that could help you through the process, nutrition resources, recipes, specialists, and support groups as well. Okay. So why is this education beneficial for me? What studies have shown, and there hasn't been a ton of studies on this yet, but we are starting to see that ultimately outcomes are better for pregnant people when they're equipped with the knowledge and the power to advocate for themselves. So, a big part of this education is giving you the knowledge to ask for what you want and tell people what you want. And that way, you have more control over your desired experience for birth. Now, we can never plan birth, but kind of knowing what we could expect, what we would prefer, and then having A, B, and C planned out can really help ease those anxieties that I've talked about already. Um, Getting childbirth education from a pelvic health therapist is unique. And I want to talk a little bit about this as well, because it's like, well, my hospital has childbirth education, or I see I can get childbirth education from, someone down the street, or I'm just talking to my friend about it. What's unique about getting childbirth education from the pelvic PT perspective is that along with this education, I will conduct a PT exam to determine if you would be a good candidate for physical therapy, especially if you're having any symptoms associated with your pregnancy. And then, even without symptoms, prepping for birth with a pelvic health therapist is essential and impactful. We get a lot of education on understanding muscles, how they work, and how they work throughout the birthing process of labor and delivery as well. So, I'll be able to use that knowledge in our education. And then I'll also provide support from the pelvic health therapist perspective, including strategies that will improve functional mobility for you and reduce risk of pain and dysfunction throughout this entire phase of not just pregnancy, but even into the postpartum period as well. And then ultimately, here at KPP, we would love for this to be a one stop shop for you and your pregnancy needs. when someone gets pregnant and they're trying to plan all the things that they need and trying to figure out all the pieces that they need in order to be prepared, sometimes it can get confusing and overwhelming. When you come into KPP, you have the opportunity not only to get help from the physical therapy side of things, but also go ahead and get the childbirth education as well. So that's one less place for you to go. So just things to think about as to why it could be really beneficial to do childbirth education here with us. And so let's get into a little bit. What exactly does this education cover, right? And so I talked a little bit about it earlier. Birth planning, that's essential. So I know it says planning, but we're really going to talk about preferences because we can never plan birth, as I stated before. And so what we're going to talk about is really contemplate on the things that you realize are important for you, for your partner or partners, your support people, and you kind of get to create an ordered list of those things. And it really paints a picture of what is actually the most important thing for you throughout this process. And that's something you really want to figure out before the day gets here, because we all know once we're in labor, it's not going to be really easy to really think about these things that we actually want. So, birth planning is an essential component of this. There's birth preparation. So this talks about getting into exactly what to expect during pregnancy, labor, and delivery, how to prepare for the actual birthing event, education on how to push appropriately, and comfort measures to help manage labor. I go into postpartum recovery. So, education on what to expect and how to prepare for that immediate postpartum phase, when a lot of times we don't get to see anyone until after 6 weeks. When you get that first checkup with your doctor. So, a lot of times people are just, learning from experience and they don't get the opportunity to talk to professionals or know what to do to help them through this time. So we'll go through postpartum recovery before you get to the postpartum. That way you're prepared. Um, and that includes nutrition, bowel health, and psychological concerns, which is very, very important in the postpartum phase. I also have education on lactation, and we talk about the benefits of chest feeding, tips to support exclusive chest feeding, and positioning tips, which is very essential from the PT perspective. I'll also provide exercises to kind of offset some symptoms that can be associated with that. The most important thing about my lactation education is that I will provide resources on how to attain further support if necessary. And from the many, many birthing people I have spoken to, a lot of times people need help with this and they don't realize that there is help out there. So I will kind of be that middleman to guide you in the direction to find that support so that that's another person of your birth team that can help you through this process. Um, and then right now, we also offer postpartum yoga sessions where I've kind of developed yoga that is specific to recovering from after birth. I am also working towards creating yoga sequences for the perinatal stage. So while we're still pregnant, and then one specific to C-section recovery, right? Because we're not all going to have a vaginal birth. And there are very specific exercises and movements we can do together that will really help aid in recovery. And then other important things that will come up, as I mentioned before, a PT screen. Our wonderful Jenna here has helped me kind of get all of my materials together so that if you are to do childbirth education, you get an ebook with all of this information and the resources attached to it. And then you'll also get a yoga video library. So as that library grows, you'll have access to that as well. All right, so we're talking about this education. How do we get it? So the first opportunity that I want to present to you all is this workshop that we are hosting on May 11th from 9 to 11 a.m. and it's called the Empower Workshop. I am hosting with my wonderful colleague, Dr. Megan Beach Gomes, and with that, we're going to discuss childbirth education and physical therapy geared towards the end of the third trimester, as well as how to maintain exercise and remain strong and pain-free through pregnancy. So with this workshop, you'll get a snippet, a piece of the education that I've described on the previous page, but it really is a good, nice foundation to help round you out and get you through the end of pregnancy and into the postpartum phase. Um, we offer one-on-one sessions in the clinic. These sessions can also be held via Zoom from the comfort of your own home, which I think is very important for pregnant people to hear. We don't always want to be running around to appointments all the time. And sometimes it can just feel really nice and safe to be at home. So, absolutely, these Zooms can be, we can do these over Zoom. And these one on one sessions, I will personalize them for your birth experience, down to the exact location you're going to be birthing at, and any tips and resources that will guide you along the way. So that's kind of the benefit of getting the one on one sessions. I really get to listen and hear all of the things that you have planned and prepped and what you need help with. And I can curate the education to highlight and answer any of those questions. And then just thinking bigger with further support. As Jenna mentioned, I am a doula as well. So if you do come in for childbirth education and think that, oh, maybe I actually want someone present during the birth and it aligns with my schedule, we can organize me being your doula as well. So once again, we're really turning KPP into this one-stop shop where you're not having to really reach out to a ton of different people to get the support that you need. Um, the nice thing about this, if that is a direction you decide to go, is that it's beneficial because we've already begun a relationship during childbirth education sessions. And so we already have started that alliance that will only help on the day that baby gets here.